Thirds of South African adults are willing to take the COVID-19 vaccine, and this is according to a recent survey which was conducted. Now, the findings, of course, come from the latest round of the University of Johannesburg and Human Sciences Research Council's COVID-19 Democracy Survey, undertaken between the 29th of December 2020 and the 6th of January 2021. So, to discuss this, I'm now joined by Professor Kate Alexander from the University of Johannesburg's South African Research Chair in Social Change. Well, Prof, thank you so much for your time and good morning to you. I mean, what does this latest data tell us in terms of adults that are willing to take the vaccine and adults that, quite frankly, are not?
Good morning to you and to the listeners. Well, it's based on a very large survey. That main figure that you quoted, 67%, gives us an indication of the proportion of people in South Africa who want to take the vaccine, and it's a higher figure than we've seen in other recent surveys, and it's a very reliable figure. So we've got 67% there, and we can break that down a little bit. We can say that 52% definitely want to take the vaccine, and only 18% saying they definitely don't want to or probably don't want to take the vaccine.
Does the research in the survey say why that's so?
Well, we have some indication of that because we can break those figures down by demographic profile, by people's political affiliations, and we've also asked qualitative questions. So we've asked people to justify why it is that they support their particular position. And when we've done that, we've found that support for vaccination is particularly strong amongst black people, particularly strong amongst people who only have a matric level education. So those things are very interesting for us. They tend to reinforce each other. And in terms of voting intentions, support is especially high for the ANC. And the ANC, of course, gains its support mainly from black people. And so those things are linking in with each other.
Yeah. Well, when we look at those who are willing, those adults that are willing to take the COVID-19 vaccine, it seems their response or reasoning is because they want to not only protect themselves but protect others.
That's correct, and it's an important finding. Nobody else has done qualitative research like this before. And when we ask people why they want to take the vaccine, overwhelmingly it's precisely as you say, that they want to protect themselves and they want to protect others. And we can contrast that with the reasons that people give for not wanting to take the vaccines. And here we find that overwhelmingly people don't want to take the vaccines because they're worried about side effects, they're worried about the effectiveness of the vaccine, and they're just not convinced about whether or not it will work for them. And that's far more important than the people who offer us conspiracy theories.
Well, I mean, we're speaking in percentages just in terms of people that participated in the survey, but do you have the correct number, the exact number of those who participated, and is it a reflection of the population?
Well, it was over 10,000, so it is a very large sample, and that's important partly because it means we can weight the sample rather well against key demographic variables, and we've done that in terms of age, education and race. So it's very representative, it's closely representative of the population of South Africa as a whole.
Yeah, I mean, we've spoken a lot here on eNCA around, misinformation and just conspiracy theories that come with vaccine. Did you see a lot of that in the survey, where some of the reasons that people gave was because of conspiracy theories or misinformation or just disinterest totally when it comes to the vaccine?
No, we didn't, and it was only a small minority of people who, when asked for their explanations, spoke about the occult or they spoke about conspiracy theories. And it's possible this is related to people's main sources of information. So still, most people get their information, specifically here about COVID, from the TV and from the radio rather than from social media, where much of the discussion about conspiracy theories has been occurring. And it may be that people who are emphasising the question of conspiracy theories have been looking at their phones and looking less at their TVs and so on. And of course the TV and radio is far more important for people who are poorer, who's, in terms of formal education, have less formal education, and that has racial connotations as well. So communications are likely to be a factor that helps to explain our findings.
All right, we'll leave it there, but thank you so much for your time. Professor Kate Alexander from the University of Johannesburg, South African, Research in Social Change.